Hi, my name's Victoria and I'm a thyroid cancer survivor. We're here at the 22nd International Thyroid Cancer Survivors Association Conference in Denver, Colorado. I'm with Beverly McLaughlin. Beverly, thank you so much for joining us.
Of course.
We're going to be talking about the positive improved outcomes as a result of patient navigation.
Yes.
Before we get started, can you please tell us a little bit about yourself?
Sure. So I've been working in the endocrinology department at University of Colorado Hospital for 25 years now. I have been the dedicated thyroid cancer coordinator navigator for probably about the last 20 years.
Sounds wonderful. Thank you so much. So can you help us understand what is your role? What is a patient navigator?
So a navigator is one who helps guide patients through the healthcare system. Many people that come into healthcare don't have the experience that they need to get through the system. It can be very overwhelming and daunting for them. And so what I do is help them navigate that. Give them access to resources, help them with making appointments, that kind of thing. They're already overwhelmed with the fear from a diagnosis such as thyroid cancer. And so navigators help them manage and work through all of those intricate details that need to be managed to access care.
Thank you. So it's interesting because we just did a survey and we had a tremendous response, and there were 4 key challenges that emerged that thyroid cancer patients and survivors deal with, and one of them is navigating the whole healthcare system, including financial obligations and just even understanding health insurance. Is that something that a patient navigator helps with?
Yeah, so navigator is kind of a jack of all trades. So they are semi-experts in insurance and what is needed to get things approved, what isn't going to get approved, understanding that Medicare has very different rules than commercial insurances, that have very different insurance rules than Medicaid. Those sorts of things.
So it starts to get really confusing,
and
then you're there to help.
Complicated.
Okay, excellent. So do all hospitals and facilities have someone like you, or I'm trying to understand as a patient, how would I find my way to you, first of all, and then how do I know if where I'm living, if someone like you is available to help?
Sure. So the larger institutions that have navigators, typically navigators are dedicated to oncology departments. If a institution has a dedicated thyroid cancer program, they more likely have a navigator or two to help specifically with thyroid cancer patients.
Even if they're not going through oncology, because a lot of us don't go see an oncologist, right?
Correct. So private physicians really don't have navigators. So if you're seeing an endocrinologist in the community, your access to navigation is more limited. If you're seeing a physician at a larger institution that has a dedicated thyroid cancer program, they probably do have a coordinator. If you're seeing a physician at a smaller community or rural, they likely have coordinators that are pretty generalized. In other words, they help cancer, thyroid cancer, which I separate the two because they're cared for so differently. And they also help just kind of the regular general populace that's not necessarily dealing with cancer. They could be dealing with end-stage renal disease or something more complex like that.
Got it. So it sounds amazing. Can you speak a little bit about then the outcomes for someone? Like, what do you think the outcomes are for someone who is able to work with you? Do they have better outcomes, a better experience?
Both, I think. So in terms of experience, it lets them kind of focus on themselves and their family a little bit more and less worrying about things like appointments and who do I call to get an ultrasound, or where do I go to get blood work done. A navigator gets them that information, and often I personally give it to them in writing. So somebody that doesn't have that, I think it causes them more anxiety because they are trying to figure out how to get through the system and just get through the next steps that they need to do, and they have less time for self-care.
Yeah. For sure. I can speak to that firsthand. And I also know that someone dealing with a thyroid cancer diagnosis, there's a lot of social and emotional impacts and things that are going through our minds. And so do you help with that if someone's having a lot of emotional?
Yeah, I call myself kind of a semi-psychiatrist.
Okay.
I'm the listening post for patients oftentimes. Okay. So I have patients that'll call me and they just need to talk with somebody who gets it. Because thyroid cancer is a disease that is one that you don't have as many of the outward signs that you have. Like when you're going through your treatment, you're not losing your hair like somebody that's going through other chemos and things like that. And so you look perfectly healthy. So what's wrong with you, right? And so patients often even have family members who just don't understand the emotional roller coaster that goes along with that kind of a diagnosis. And so they'll call me to do that. They'll call me to go over things like the low iodine diet. You know, we have a fairly large pediatric group of patients, and I've had kids from high school call me on their phones while they're in the lunch line. Can I have this on my low iodine diet? Yeah. So it helps to know they have somebody that they can call, that they don't have to like call and leave a message and wait for somebody to call them back and that kind of thing. You know, most navigators happily give out their direct numbers and take on those kinds of phone calls.
That sounds amazing. I wish I had found you 10 years ago. So is there anything else that you think someone who's just received a thyroid cancer diagnosis, or even someone who's 10 years out, because this is a lifetime journey.
Diagnosis.
It's a lifetime of follow-up and potential treatment. What else should thyroid cancer patients know about patient navigation or coordinator?
So, you know, I think they need to know that they have access to me their entire journey, you know.
For life.
Correct. Wow. And so as long as they are coming to us for their care, they can access me and get help. I mean, sometimes I often have patients that call and say, you know, my husband just had this diagnosis of something else. Who can I call? And so, you know, I think that patients just need to always know they have a point of contact that feels safe, that feels accurate, and, you know, it will just help them through the whole process and just give them a little bit more comfort and a little bit less anxiety.
I love that so much. Thank you for all that you do, and thank you for being here with us today. I think an important takeaway for anyone watching is ask if there is a patient navigator or coordinator available to you where you are being treated, because it sounds like an incredible support for anyone who's going through thyroid cancer treatment. Thank you so much for being with us.
You're welcome.
We hope that you've learned something today, and thank you for watching.